dissected like that, so you can recognize them. Okay, did that. Okay, so your quadriceps group then is underneath the sartorius, so it'll have to be flat back. And there's three pinnable ones. The vastus medialis on the medial side, the vastus lateralis on the lateral side. So I could do it, I could identify it with the gluteals. There could be something pinned there, and then I'll pin this guy. So that's your vastus lateralis. And in between the vastus medialis and the vastus lateralis is the big rectus femoris. Okay, what is the action of these muscles? They all extend the stifle, and name three others with the same action. That's the only time you'd have to know vastus intermedius, because it's deep and not pinnable. And I did those. Did that. Okay. Yep. Then the hamstrings, okay, are on the back of the leg. There's three. Two of them are best seen medially. So you've got your gracilis and the adductors, the pectineus and the adductor muscle. Then you've got your semimembranosus, and the most caudal is the semitendinosus, running up the way back of the leg. The biceps femoris is the other, that's the biggest one. It's really big, and it also can abduct the leg to a certain extent, but its main function is to act as a hamstring, which is to flex the stifle. If you lift up so the three hams again, your biceps femoris, your semitendinosus, and semimembranosus. So it could be done medially or laterally. Semitendinosus, semimembranosus, biceps femoris, or medially semitendinosus, semimembranosus. I just can't do the biceps femoris medially. Underneath the biceps femoris is the humongous sciatic nerve that you have to know. That's certainly pinnable. sciatic. And in the fat pad behind the stifle is the popliteal lymph node. There he is. Popliteal lymph node. So any pin that says name this structure in the fat pad back here, what else can it be? It has to be the popliteal lymph node, even if you're not sure. Don't say adipose tissue. That's not an answer. I'm not going to ask a question like that, okay? So I got that one here. Then the gastrocnemius is the big calf muscle, which is attached by the Achilles tendon. So name this structure. To the calcaneus. So name this structure. What bone does it attach to? Calcaneus. Or on a skeleton, I'll put a tab on the calcaneus and say what tendon attaches to what muscle. So then you have to know Achilles tendon to the gastrocnemius. Okay? Oh yeah, and then the femoral artery and vein run side by side. So you can pick them out a little further down, but there you can see them right there. There's the femoral artery and the femoral vein. So the femoral vein, again, you might want to pick these out, but you can see the femoral vein continuing here. After the stifle, it's the saphenous, which has gotten busted here. So the saphenous, there's a medial and a lateral. We'll just go with saphenous for now, okay? And did that. And did that. And that's it. That's all. That's all. No biggie.